Joining me now is Dr. Rachel Villanueva, President of the National Medical Association, and that's one of the organizations that signed that statement. So first, thank you for joining us this morning. But why did your organization decide to take this stance?
Good morning. Thank you so much for having me today. I think all of the organizations that signed on found the critical importance in encouraging healthcare facilities and hospitals to mandate their workers get vaccinated to protect not only our patients, but really to protect our colleagues as well. I think we're seeing the surge with the Delta variant so much more effective and dangerous to everybody, and particularly those on the front line who are taking care of patients, not only protecting themselves, but our patients.
So over the last month or so, we've kind of seen, a couple of sporadic protests by healthcare workers that are pushing back against a mandate like this. So do you expect any more pushback from the healthcare community on this, especially from those who don't really want to get vaccinated?
I think it's really understandable. Anybody who's forced or mandated to take something should have concerns and should ask their questions. I think healthcare workers are not unlike any of us who are vaccinated who had questions initially. But I think when you are a healthcare worker, you are held to a higher standard. It's your responsibility to put your patients' well-being and interest in front of your own or your own opinions. And I think healthcare workers have been held to a higher standard for as long as we have worked in the industry. We take vaccinations for many things as workers in the healthcare field. We have to get the flu vaccine. We have to get a hepatitis B vaccine, for example. So this is not unlike any of the other vaccines that we take to make sure that we protect our patients and ourselves.
So what is your message then to those employees who may still be kind of on the fence about getting the vaccine or just simply don't want to be forced to do it?
I think it's really important to just understand where those workers are coming from, to answer their questions. I think we know there's a lot of misinformation about the vaccine. And just because someone's a healthcare worker doesn't necessarily mean they have that particular knowledge base to understand what the vaccine is. And so I think it's important to make sure they're educated about the importance of the vaccine and ultimately to really encourage and support the decision to get vaccinated.
So your organization represents more than 50,000 Black physicians. So do you think vaccine hesitancy is still an issue in the Black community?
Absolutely. And I think it's really more an issue of vaccine confidence than hesitancy. I think our community needs to get educated. That's one of the things. I think there's, again, as I said, there are a lot of myths and misinformation out there that is causing a low vaccination rate among our community, as well as other issues with the healthcare system, with bias, issues of discrimination currently and in the past. And I think it's just important for us to really understand and validate where our patients are coming from, to understand where they're coming from, and to support their decision to get vaccinated.
All right, Dr. Rachel Villanueva, President of the National Medical Association. Thank you.
Thank you.